Hello and welcome to the Winter Park Chamber webinar series. My name is Tiffany Cahill and I am the events manager at the Winter Park Chamber of Commerce. We are thrilled that we're able to continue to convene people through our virtual programming and through this webinar series as we move forward with these unprecedented times. So we appreciate everyone joining us today, whether it be here on Zoom or on Facebook Live or watching on demand after the fact on YouTube, on Facebook as evergreen content. Thank you so much for joining us. Before we get started, we do encourage our attendees to engage in some virtual networking. You can do that if you are on Zoom by engaging in the chat box. If you hover over the bottom of your screen, you'll see a chat icon pop up. Go ahead and click that and you can let us know who you are and who you're with and engage in some virtual networking. You can also do that on Facebook Live in the comment section. We would love to know who is joining us today. Furthermore, you will be able to ask some questions at the end of the presentation. So if you do have a question that you would like to ask throughout the presentation, feel free to do so by either raising your hand or you can insert your question in the Q&A feature, also located at the bottom of your screen, and we'll be able to get that answered. Same with Facebook. If you have a question, go ahead and drop that in the comment section. We'll go ahead and get started. As I had mentioned, it is our mission here at the Chamber to convene people and ideas for the benefit of our businesses and our community. And we're so thrilled that we're able to do this virtually. This webinar series, we're continuing to offer this webinar series in an effort to help the businesses and the community to help them navigate through the COVID-19 pandemic. We have been sourcing experts throughout the community to share information, best practices, and practical advice. And we are thrilled today to hear from Charlie Culver, who is one of the owners of Speedy Paint LLC. Charlie Culver is an owner of Speedy Paint, a commercial and residential painting contractor, which also provides commercial facility disinfecting under the brand Speedy Cleanse. He also provides coaching to businesses that want to implement and manage the disinfection process internally and to do so safely while optimizing results. Having accredited facility infection prevention certification, Charlie will share valuable insights on maintaining a healthy facility environment and protecting employees and facility occupants when combating the COVID-19 pandemic. Charlie, if you are ready to go, we are thrilled to hear from you and your presentation.
Tiffany, thank you. Can you hear me okay?
Yes, we can. Sounds good.
Perfect. Thank you very much. Good to be here. Hello, everyone. As Tiffany just stated, some challenging times that we're all living in right now, dealing with this pandemic in so many different ways. One of the challenges is maintaining a healthy facility environment and protecting our employees and our facility occupants while we're combating COVID-19. And so facility disinfection is important, but we have to be careful not to make the fix more problematic than the problem itself. And that's a big part of the challenge. So our focus today is on businesses which are attempting to manage the disinfecting and the health of their facility with their staff, doing so internally. But I will take a little bit of time too to talk about contractors and selecting contractors, what to look for in a contractor if you're looking for one for disinfecting services as well. But primarily, I'm going to focus on your ability to disinfect internally with staff and do so safely. I hope that you come away with one or two good pointers from the next few minutes that we spend together, some best practices that help you out, better protect your business, your employees, your customers, because that's really what this is all about. I'm focusing primarily today on community facilities. Community facilities are defined as businesses, schools, daycare centers, places of worship, etc., non-healthcare settings. So time for me probably to offer a little disclaimer too as we get started here. There is no one solution that fits all businesses and all facility types when it comes to disinfecting. Businesses are very unique. Restaurants, food processing, manufacturing, hospitality, call centers, they're all very unique. You know, fitness centers, they all have different types of materials that are contained within the environment, both surfaces and objects. They have different densities. They're each unique. So I'm not here to tell you how to disinfect your particular facility, but I'm going to share insights that help you safely manage the process, whether you're doing it internally or contracting a service provider. So with that, let me move this to the next slide, and we'll look at our agenda real quick. We're going to run through sanitizing versus disinfecting, defining the differences, when to and not to disinfect. We'll look at the dangers associated with disinfectants in the process. I think I'm going to spend most of the time here because it's such an important topic, and there's so many people out there doing this wrong, and it's going to create some long-term health challenges for us here, I'm afraid, in society. So we're going to talk quite a bit about the dangers. We're going to look at when the personal protection equipment is required, talk about some do's and don'ts, some ways to measure clean, very important. As I mentioned, some pointers on selecting a contract, and then choosing disinfectants, safer alternatives that are out there. So I'm not going to tell you, certainly not going to tell you what disinfectant to use. I'll share with you what disinfectants I use and recommend internally with our company, but and some resources for you to look at disinfectants further, but you'll end up selecting your own disinfectant. And then, of course, I want to talk about barrier protection. This is equally as important as well. So what's the difference between disinfecting and sanitizing? The key difference is that disinfecting services, we use EPA-approved disinfectant solutions which destroy or irreversibly inactivate microorganisms on surfaces. Sanitizing services are different in that they reduce, but they don't always eliminate these microorganisms from surfaces. We sanitize all the time when you think about it. We sanitize soft, porous materials. We steam clean carpet. We wash clothing. We sanitize food products such as glasses, dishes, utensils, etc. We disinfect non-porous surfaces, so hard surfaces. And according to the EPA, there's no disinfectant that can claim to disinfect soft porous surfaces. So when you look at your disinfectant label, you'll notice that in the directions it says for use on hard non-porous surfaces. There are some exceptions. The EPA allows for some disinfectants to have a soft surface sanitizing claim. So you will see that on some disinfectants, but for the most part, disinfectants are designed for hard surfaces, for non-porous surfaces, specifically high touch points. So they're not to be used on porous surfaces for the most part. So when do we disinfect and when do we not need to disinfect? Just some general guidelines. If you have a building that's been empty for some time, then you probably don't need to disinfect. So a lot of buildings did vacate at the beginning of the pandemic. Many have been reoccupied by this time, but there's still some situations where they have not been. The CDC states that 7 days, assuming that there's no known cases of COVID-19. So if a building's been empty for 7 days, assuming there's no known cases, there's no need to actually disinfect. But it's a little bit vague because also what's published at this stage on the virus is that it can survive on glass for 5 days, wood for 4 days, 3 days on plastic, 3 days on stainless steel, and 24 hours on cardboard. But there's a couple of exceptions to this, and that is, you may have read that the virus was found on surfaces on the Princess cruise ship 17 days after all passengers and crew disembarked. So that's a little bit troubling. Also, there's scientific literature published in the Journal of Hospital Infection, just recently published, that says that the virus can potentially survive on surfaces anywhere between 2 hours to over a month. So there's lots of conflicting information, and I would have to say that we just don't really know at this point. So let's talk a little bit about disinfectants at this stage. Let me move the slide here. So disinfectants are distinguished into 2 categories. You have your hospital type and your general use. General use is household. Today we're looking at hospital type disinfecting services for commercial facilities. Always want to use hospital type disinfectants. That's the type of disinfectant that's used for infection control. And used properly, if we use disinfectants properly, they're designed to protect public health. But many are being very careless with disinfectants, so we're seeing a lot of situations take place in society today. Disinfectants are being overused. We're exposing workers and consumers to some chemicals that are largely untested for human health. The biggest issue is that many people are not reading and following the product label for the disinfectant that they're using, and that's causing a lot of problems. We don't like to think about it, but most heavy-duty disinfectants are just chemotherapy for our environment. So the idea is to poison all the microbes around us and hope that those poisons don't damage human or animal health. And that's a pretty bad bet because, as we all know, toxins can accumulate in the environment and in our bodies. So these disinfectants, they're dangerous. They're registered with the EPA as a pesticide. And they're registered as a pesticide not because they're safe, but because they're dangerous. They kill. So an EPA registration is an acknowledgement that the product contains toxic chemistry dangerous to humans and animals and our environment. And therefore, they need to be used in strict accordance with the product labels. That is why you'll also notice on disinfectants, on the products themselves, on the labels, you'll see stated on the label that it is a violation of federal law to use this product in a manner inconsistent with its labeling. And the fact that people are using these disinfectants inconsistent with their labeling is what's causing a lot of the problems that we see out there today. So you really need to know what you're doing when you're working with the disinfecting. And really the key is simply reading and following the product label and also the safety data sheet. These are key. You want access to both, whether you're doing this work internally or you're contracting this work out, it doesn't matter. You need to be familiar and want to be familiar with the product label and the safety data sheet, the SDS. Everybody involved should be doing this. It's very important to understand the concentration, the application process, the dwell time, which we're going to talk more about in a minute, the personal protective equipment that's required, all followed by label. As we see here on this slide, calls to the U.S. poison centers about cleaner and disinfectant exposures have increased 20%. That between January of this year and March. That's 20% year over year. That's a huge increase, obviously, and that's data that I have just from January to March. Here we are in late August. Who knows what that number is now? But the point is that it's alarming, right? We get the message. And so what are some of the hazards working with disinfectants? What are people doing wrong? Let me give you just some examples that I've seen out there to help illustrate some of the concerns. I saw a video not too long ago. It was a contractor in the industry that was showing their ability to provide COVID-19 disinfecting services, and they were disinfecting a healthcare facility. In this video, the reason that they were called in is because the healthcare facility had a patient testing positive for COVID-19. So they closed off and they secured the examination room, and of course tried to trace back where this person had been in terms of in the lobby and potentially the restroom and so on and so forth. But here's the mistakes that the contractor made. First of all, they disinfected the examination room first, then the technician, and we're watching all this on this video, then the technician doing the work proceeded to disinfect the remaining office areas. So this technician did exactly the opposite of what should have been done. What should have been done in this case, they should have disinfected the entire area that they were going to disinfect other than this isolated area. That should have been done last. By going in and disinfecting this area first and then disinfecting the rest of the office area, they potentially exposed other sections of the office to COVID-19. The other thing that was going on is that this particular technician was not wearing the personal protective equipment properly, exposing his wrists. So this is not a good situation. And it all tracks back to a lack of training and putting everybody at risk. That healthcare facility wasn't anywhere in our area, so there's nothing to worry about there. The other one I'd like to point out that occurred up in the Northeast is the EPA had to order a contractor in the Northeast to stop disinfecting its ambulances. So what was happening is the contractor was fogging inside the ambulances a disinfectant. And as a result, they were poisoning the ambulance workers and the paramedics. They were experiencing skin and eye irritation, asthma, headaches, ulcers. Again, not a good situation. They should have never been fogging a disinfectant in a closed, tight, indoor, contained area like this. When people are fogging something, it's being fogged out at very small droplet sizes. These are foggers typically put out droplets the size of 10, 20, and 30 microns, which is very, very small. And of course, inside an ambulance, there's all kinds of both porous and non-porous surfaces. So that was not a good situation. That was just neglect by the contractor, but again, it put everybody at risk, including those in the ambulance. Not too long ago, just kind of to support this statement, citing the ineffectiveness and some health concerns, the World Health Organization recommended against the use of spraying or fogging disinfectants for COVID-19 in indoor spaces due to adverse health effects. So all this is still being looked at, it's still being studied. So if you're talking to a contractor, for example, and they say that they're going to come in and they're going to fog your entire facility with disinfectant, run. So here's another one that troubles me a little bit, and this I read last week. This is a school in Arizona that is installing jumbo misting fans in classrooms to disinfect. So these are the fans that you see on the side of football fields that spray a mist to help cool players and staff during games when it's very warm outside. These are the types of events that are taking place that personally give me great concern. In many situations like this, I'm as concerned with the disinfecting process that's taking place as I am with COVID-19. So to me, putting a fan like this, which was not designed to spray or fog or mist disinfectants in the first place, it's much like putting an autonomous car on the road without a driver. At some point, there's going to be an accident. An accident's going to happen. You know, what happens if for example, a child gets back into a classroom when the machine is running? If the machine is running unsupervised, which in fact it is, there's all kinds of events that can happen in situations like this. If I was a parent today with kids in school, I would be very concerned with what the disinfecting process is in that school, in that environment that's taking place. But you'll read about and see things like this all the time, and we're going to start to see probably some unfortunate results from some of these types of activities. You'll see as you go through the course of your day mistakes being made, such as workers with a spray bottle. You see this all the time. They take a spray bottle with disinfectant and they're spraying directly the surface of a tabletop or a counter, for example. When they spray directly on the surface, and if a pathogen is on the surface, they potentially airborne the pathogen in droplets and cross-contaminate. You'll also see workers, in many cases, they take a rag, the same rag, and they're disinfecting multiple surfaces. So you could be tabletops, for example, in a restaurant where you see the same rag being used to clean multiple tabletops. Again, potentially cross-contaminating because the pathogen might have been on one tabletop and not the other. The correct method is to fold the cloth in squares using a clean section to wipe each of the surfaces. And in terms of using a spray bottle, the incorrect method is spraying the surface directly. The correct method is to spray the rag or the cloth that you're using, then wipe the surface. There's less chance for cross-contamination in that process. The other thing that you see is you see people not using their personal protection equipment or any at all, working with disinfectants, or in many cases, they're layering different types of disinfectants rather than identifying and working with one type of disinfectant. So they're layering these disinfectants, these chemicals on surfaces, different chemicals. And one of the biggest mistakes that I see is that not applying properly to label specifications for dwell time. So the dwell time is the contact time that's required on label for the product to be wet in order for the disinfectant to work, to do its job. If it's simply put on a surface and wiped off immediately, it hasn't done what it's supposed to do. It hasn't disinfected. All these disinfectants require a dwell time, a time to be on the surface, to be wet on the surface. And many of them are as much as 10 minutes. And think about it. 10 minutes is a long time to keep a surface wet in an air-conditioned, temperature-controlled environment. It's not easy to do. So when people are using disinfectants and they're simply wiping on, wiping off the disinfectant, they're really not doing that much. The list goes on, but you get the point. We have people rushing to disinfect. They're not trained. They don't know what they're doing. They don't understand the dangers surrounding the disinfectants. Mainly, they're not paying attention to label. So with that, let's move to the next slide. I want to talk a little bit about choosing disinfectants and specifically safer alternatives. So again, I'm not going to tell you which disinfectant to use, but I do want to help guide you, if I can, to resources so that you can decide. And then at the end, I'll talk a little bit about the disinfectants that we prefer in our business. When I look for a disinfectant, I'm looking for a safer alternative. Remembering what I said about disinfectants earlier and why they're registered as a pesticide. It's because they're dangerous. So when you're looking for disinfectants, you obviously want a hospital grade disinfectant, as that's what you need for infection control. Preferably, you want a one-step hospital disinfectant cleaner. And there's several out there. But you'll note on the label, even when a one-step hospital disinfectant cleaner, you're going to note that on label it's going to say that it's not effective with organic soils greater than 5%. And when you think about it, a soil on a surface, a 5%, that's pretty naked. It's pretty hard to see with the eye. It really is. So, you know, a label statement typically is going to read something like this: effective against stated germs in the presence of 5% serum or 5% organic load or bioburden, indicates the product is a one-step cleaner disinfectant and is effective in the presence of small amounts of organic soil. So again, the CDC tells us that in all cases, we should be cleaning a surface before we disinfect the surface, primarily because of what we're talking about here, the organic soil. There's also biofilm, which is protecting pathogens on the surface, which cannot be seen. And disinfectants cannot permeate biofilm, so surfaces therefore need to be cleaned first. There's hundreds of disinfectants on the EPA list, which I'm sure you know everybody has been to the EPA list probably at this point. There's only 2 that actually have been tested and approved for disinfecting COVID-19. And those are 2 Lysol products that just recently were approved. Now, there'll be more approved specifically for COVID-19, and that doesn't mean that all the others don't work against COVID-19. They're on that list because they actually kill a pathogen, a virus stronger than COVID-19. So, but the Lysol, you know, today has the first 2 that have been approved that are on the EPA list. A little bit more information when you're looking at disinfectants. You know, some keys are you want to look for disinfectants that are non-abrasive, non-corrosive, preferably no rinse required, even on food contact surfaces. You definitely want a disinfectant that is NSF certified. If it's NSF certified, that's the National Sanitary Foundation. That certification is your key to making sure the products that you're about to use meet very strict standards for public health protection. I prefer EPA toxicity category 4, which is the lowest toxicity. There's 1, 2, 3, and 4. 4 is all you need with a hospital grade disinfectant to get the job done if you're doing it properly. Preferably one that's free of volatile organic compounds. When you look up the EPA registration number, sometimes when you're looking up a product, if you come across a product that you're interested in, you really want to have the EPA registration number because you may not find it on the EPA N list by name. You may need to find it by registration number. You want one that's compatible with the surfaces that it's being applied. And of course, you want one that has a dwell time that you can work with. So the dwell time, again, being very important for the disinfectant to work, it needs to have that dwell time. When if you're working with a product that requires a 10-minute dwell time, that's going to be pretty hard to achieve. Talking about PPE requirements, personal protection equipment real quick. If you have your employees performing disinfecting tasks, then of course, it's your responsibility to make sure you provide them with the personal protection equipment that they need. They always must wear personal protection equipment when they're working with disinfectants. And the employee may want to be comfortable working with disinfectants. They may want additional PPE than what's on label. So the label may call for goggles, for example, and gloves. You may, in fact, have an employee that says, I want an addition, I'd like to have a face shield and a gown to work with this disinfectant. And it's up to you then, of course, to provide them with that. They also need to be trained on fitting and wearing the PPE, as well as safe removal and disposal of the PPE as well. And there's some great resources right online through the CDC that can help you with that. And then, of course, as you're disinfecting, I mean, special consideration always, of course, for people that have asthma. They shouldn't be present. They certainly shouldn't be involved in the cleaning and disinfecting process. And they shouldn't be present, of course, when it's happening anyway. Some pointers on selecting a contractor real quick. If you're contracting disinfectant services, be sure to ask how they're measuring clean and identifying potential pathogens. This is really important. The response that you want back from them is that they measure and report ATP levels to you. So ATP stands for adenosine triphosphate. ATP is an energy carrying molecule found in the cells of all living things. And so when it comes to surface hygiene, like we're talking here, the lower the ATP level, the cleaner the surface is, the less likely it's going to harbor biofilm and pathogens. So as a result, the USDA and the International Sanitary Supply Association, they both endorse ATP metering to measure surface cleanliness. This is done using luminometers. They're used to check the ATP levels. You see these instruments commonly used in food processing settings and also in healthcare. And this is a way that you can scientifically measure clean. You want to know also, what disinfectant is the contractor using? How is it applied? How do they achieve the dwell time required? How is the surface clean before the disinfectant is applied? What surfaces are you going to disinfect? How do you determine clean, as we just talked about? You want to make sure that they provide you with the safety data sheet, very important. And you want to know when the facility is going to be safe to reoccupy. All questions that need to be asked and answered. And then another key is be sure that you ask for their certificate of insurance, and you want to verify that they have pollution coverage of at least $2 million to cover any incidents that might come up during their work. You want to make sure they have an umbrella policy, which has extra liability insurance, preferably $5 million or more is a good indication that the company is properly insured. Let me talk a little bit about disinfectants that we like and why. Again, I'm not here to tell you what to use. I want to help guide you, of course, to the best of our ability. We have two primary go-to disinfectants and one barrier protection product that we use. Depending on the environment, we determine which disinfectant to use. So for example, one is an advanced hydrogen peroxide, AHP, it's referred to. This particular disinfectant is called Oxiver. It's by Diversey here in Florida. The other product is a botanical. It's a Thymox-based product called BioEsk. In addition to the disinfectants that we use a barrier probiotic product. This is a microflora mist product. It's manufactured by a company called Z Biosciences. When you go to look up your disinfectants on the EPA N list, as I mentioned earlier, sometimes you have to have the EPA registration number. You can't get to it just by name. BioEsk is one of those. So if you wanted to look it up, for example, you would use thymol as its name, and its EPA registration number is 87742-1. That's 87742-1. Interesting too about the Thymox technology was developed in Canada. It's the first agricultural disinfectant to obtain the UL Eco Logo certification they have in Canada. So that's a very respected environmental certification, kind of a green certification, if you will, which this product has in Canada. We don't have an EPA green certification program here in the United States, but they do in Canada. Both of these disinfectants meet our primary criteria, which is that they're hospital grade, they're non-abrasive, they're non-corrosive, there's no rinse required, they're NSF certified, EPA toxicity level category 4, they're free of VOCs, they have very good dwell times. The AHP product has a 5-minute dwell time, and the BioEsk has a 4-minute dwell time. So both very workable in temperature controlled situations. Again, the AHP's active ingredient is hydrogen peroxide. It breaks down into water and oxygen, leaving no residues on the surface. It's formulated to ensure that it doesn't have any negative impact on indoor air quality. It's been approved as an asthma-safe product. AHP, as I just mentioned, it has a really good contact time of 5 minutes. And so these short contact times for surfaces to remain wet, they're very important in order for the disinfectant to work. Again, you have to look at the temperature, the environment that's being controlled. It's not easy to keep a surface wet for the period of time required. The downside to the AHP is that it's not for copper, it's not for brass, zinc, granite, marble. So there's certain environments where it's not really applicable. The downside to the BioEsk is that some people don't like the scent. It's kind of a fresh lemongrass grapefruit scent. Some of us like it, some people don't like it. We happen to like it. My wife actually likes it very much. We use the product in our home as well for disinfecting. It's just a great all-around product. I want to speak to barrier protection a little bit. On the computer right now, you see a slide from Z Bioscience. Barrier protection is very interesting. And the reason for barrier protection is that these disinfectants, when they get done doing their job, when that dwell time is complete, they provide no residual protection once they dry. So these surfaces are vulnerable immediately to pathogens again. So early on, I discovered this company called Z Biosciences, and it was through an article that very early on in the pandemic, the New York Stock Exchange was shut down because of the pandemic, as we all recall. And within a few days, they were doing a deep cleaning and disinfection process inside the New York Stock Exchange. And the product that they completed this process with is this Z Biosciences Microflora Mist. It's a probiotic. It was being used as a barrier product to help protect the surfaces and help protect the people in the facility for an ongoing basis. So these products typically provide another 3 days of protection when applied, and they're misted using fogging equipment. So they cover just about everything. Very interesting product, very interesting science. It's also a product, Z Biosciences is being used, the probiotic products, both as cleaners and the microflora mist that I just mentioned are being used extensively in school systems as well. This product was developed for both agricultural and commercial use, but definitely a product to look into that can help will provide some additional benefits, some additional protection from pathogens. Also, it's a great deodorizer product as well. There are some chemical alternatives that are coming out. There's chemical alternatives that have been out, for example, UV light. Um, that is a chemical alternative that's available. The problem is that while these have been used in health hospitals and healthcare settings, they're very expensive. So they're just not affordable for most of us in business, for sure. But that's changing. There's some new technologies that are coming out right now that use UVC light. It looks like they're going to be pretty affordable, potentially. There's going to be both purchase and lease options. We're looking into that closely at our business, and would be happy to share that information as it is released. Um, Again, I expect this information fairly shortly, and that is an alternative to the traditional chemical uses. I think we're going to see more and more people. I look at what's happening, and of course, on the other side of what we're all going through with this pandemic, we're going to see changes in the way that we do things. Most of us, our antennas are up. We're very aware of our environments now. We'll probably continue to be very aware of our environments. We'll probably be more aware than ever of what we use to clean our environments. I'm a big believer in probiotics. We've completely converted our home here to the use of probiotics. We use them in our businesses. Just a great line of products through Z Biosciences. I can't say enough about it. You'd have to do your own research and judge for yourself. But I think on the other side of this, it's going to be a great opportunity for all of us to help protect our environments using very safe products. So with that, I'd like to, if we have time, open up for questions. Tiffany?
Wonderful. Thank you so much, Charlie, for sharing all of that really informative information. I know a lot of businesses are in need of this information right now with buildings opening up again. So thank you so much for taking the time to do this. As Charlie mentioned, it is time for audience questions. If there are any questions, go ahead and feel free to ask those questions either by raising your hand, and we can unmute you so you can ask your question verbally, or feel free to insert your question in the Q&A box, which you'll find at the bottom of your screen if you hover there. If you're on Facebook, go ahead and feel free to insert your questions in the comments below. Charlie, I do have one question. You've provided us with a lot of insights on disinfecting. What services does Speedy Paint and Speedy Cleanse provide?
So a great question. Obviously, we started in the painting business. My brother and I own a couple of businesses in the area. Speedy Paint provides residential and commercial painting services, and we expanded our services into commercial disinfecting. We don't do any residential, strictly commercial disinfecting. We also have a pest control company. We deal with pesticides. We have licensed pest control technicians. We service 9 counties in Orlando and Tampa with that business, Critter Control of Orlando and Tampa. The business, like I said, it's been in the area for 20 years. With the disinfecting, a few different services that we have offered. We primarily have provided the commercial disinfecting to our existing clients. I find that in terms of helping businesses with the disinfecting process, coaching has been probably the best option. A lot of businesses want to do this themselves. In many cases, it's cost prohibitive. It's pretty hard obviously, to be calling in contractors all the time. It's costly to do that. If there's a known case of COVID-19 and a deep cleaning and disinfection process needs to take place, that's one thing. But on an ongoing basis, cleaning and disinfecting the facility in many cases can be done internally and can be done safely. So coaching is one of the services that we've been providing to help businesses accomplish that and accomplish it safely. It just depends on the business, the level of need that they have as to how much time we spend on. Generally, it can be done in a 2 or 3 hour time window, and it can be done virtually. In some cases, it needs to be done on site. Taking the ATP readings is another service that we provide, being able to measure scientifically the surfaces and identify surfaces that potentially have infectious disease. So that's another service that we provide as well. And then, of course, as I mentioned earlier, the probiotic product, the fogging of this product, once disinfecting has been completed, it's another option that's being offered. So thank you for asking that question.
Absolutely. Thank you for answering. All right, so we have another question. If we are preparing to open our building, how early should we begin disinfecting, and then how frequently should we continue as we receive customers?
So if the building has been vacant, which I understand from the question, it sounds as though the building has been vacant. Back to the CDC recommendations, they're saying if the building has been vacant for greater than 7 days, then you don't need to disinfect. Now, we see some of the other information that I shared here today, such as the Princess Cruise Line, the 17 days that there was evidence of coronavirus. So it really depends on how long the building, there's a lot of variables here. How long has the building been vacated? If you follow CDC guidelines and it's been vacated for more than 7 days, then you don't need to disinfect to get back into the building. On an ongoing basis, depending, it depends on your traffic. What kind of business is it? Is it open to the public? Is it the public that are coming through, or do you just have employees? So there's a lot of variables as to how often you're going to disinfect. I'd really have to talk with the person individually to understand their environment and the type of traffic that's taking place in their environment to be able to give them an answer. But you're going to want to focus on the touch points and the key touch points in the facility. And that's the main thing that you want to identify what those are, and then you want to come up with a regimen for both cleaning and then disinfecting those surfaces.
Perfect. Thank you so much, Charlie. And we have one more question from Bill Conwell. Relative to barriers to infection, how long does the barrier last? How often should barrier applications be applied?
Yeah, great question. So the barrier lasts for 3 days. And so, I mean, technically it should be reapplied every 3 days, but we don't see that very often. If you're reapplying it once a week, that's really all you need to be doing with the barrier treatment. And particularly if you're using the probiotics in between, if you were to switch your cleaning products to the Z Biosciences probiotic cleaning products, then you could probably space that out even longer.
Wonderful. Thank you so much. It looks like those are all the questions that we have for today. So thank you so much, Charlie, for your presentation and for answering our questions. We are so appreciative that you took the time to do this for us. We want to let our viewers know of some upcoming webinars and events that we have scheduled. Next Friday, September 4th at 10 a.m., we have our Good Morning Winter Park program featuring Scott Carr, who is the Deputy Athletic Director at the University of Central Florida. He'll be giving a UCF athletics update. And then following that, next month on September 25th, it is going to be our first in-person live event at the Alfond Inn. It's our Winter Park Outlook from 10 to 11:15 a.m. at the Alfond, and it's going to be focusing on Winter Park's robust recovery. That's our topic for this year's Winter Park Outlook. The price is $25 per person, and we are at limited capacity to provide the appropriate amount of social distancing for the crowds that are coming. So be sure to check those 2 upcoming events out on our website. Feel free to follow us on social media, Facebook and Instagram, and subscribe to our newsletter. Charlie, thank you again so much for your time. We appreciate you sharing all of this very valuable information with us. I know there was always a lot of questions about disinfecting and the safety of certain disinfectants. So thank you for your time today.
Thank you, Tiffany. Thank you for inviting me.
Absolutely. And thank you again to our viewers. We hope you have a wonderful rest of your afternoon, and we look forward to seeing you on one of our next webinars. Have a good afternoon.